This is Right to Life Radio, a production of Right to Life of Central California. And now, here's your host, John Girardi.
All right, we've got more about UCSF Fresno and their interim director of OBGYN, Dr. Meg Autry. I went to a public lecture she gave last Thursday at UCSF Fresno, or tried to give. It was kind of the biggest Zoom flail disaster you've ever seen. And I've learned a little bit more about her work and sort of her, what is happening with medical student training here in the state of California through UCSF Medical School. Now, I've long known that UCSF is kind of the epicenter of all abortion evil in the state of California. UCSF has their whole Bixby Center for Reproductive Health, which is basically a place where, within the context of UCSF Medical School, medical students are trained in performing abortions. They do abortions. They train medical students how to do abortions. The director of that center, Dr. Daniel Grossman, is one of America's leading abortion advocates, abortion/public policy advocates. So it's a whole thing. It's basically Dr. Grossman, anytime there's a major piece of abortion legislation, he goes to Sacramento and testifies. So they have a huge amount of influence on public policy, on actually doing abortions themselves. A lot of our friends from Pro-Life San Francisco have detailed their strong suspicions that UCSF is performing possibly fourth trimester abortions, like live delivering children and then killing them. They have some suspicions of that. And so UCSF is extremely, extremely bad when it comes to abortion stuff. So we know that to be the case. I think, though, people have some sense that in Fresno, that if something's in Fresno, it's not as extreme left-wing, and that would be incorrect. UCSF Fresno, and let me just sort of explain to people what UCSF Fresno is and what it does. UCSF Fresno is basically an extension of UC San Francisco's medical school, and it is sort of an entity designed to manage a residency program. So you go through 4 years of medical school, you then become a resident. So you have your doctorate, but you are still somewhat in training, and you haven't taken your boards yet. You are a resident. So UCSF has a San Francisco residency program, and they have a Fresno residency program. That's what UCSF Fresno is. So UCSF Fresno has a number of doctors who are professors who are designated as being faculty members for UCSF Medical School. And they have arrangements for their residents to go and work at a number of different local hospitals, healthcare providers in the Fresno area. So UCSF Fresno's building is right next to Community Hospital downtown. They have arrangements with Community Hospital in downtown and in Clovis and a bunch of other healthcare providers. My dad, who's a surgeon at Valley Children's, has done a lot of stuff teaching UCSF residents. Now, in her role, Dr. Autry is the head of OBGYN, so she is charged chiefly with teaching residents, instructing residents about OBGYN. And as we detailed last week on the show, she is a committed abortion, I would say, activist, because very friendly publications have also described her as an activist. I don't know that she would even disagree with the title of an activist. One of the chief ways in which she has shown her activism is that she started a nonprofit whose goal is to set up a floating abortion boat, basically a boat that will be parked in federal waters in the Gulf of Mexico to provide surgical abortions through 16 weeks of pregnancy. And this is in response to Texas, Louisiana, Mississippi, Alabama, Florida, all passing laws to limit abortion in various respects. So she wants to park off the coast, provide abortions to people living in those states. There was a Dutch ship that did something similar, this Dutch nonprofit that would bring a boat that would provide abortions off the coast of a number of different countries that had legal restrictions on abortion. So they would go off the coast of Mexico. They would go to Ireland, all kinds of places. So I think Dr. Autry is sort of acting in this vein to start this nonprofit. Now, I was thinking more about this, and what a cockamamie, insane idea this is. So, and it highlights a lot of Dr. Autry's work is highlighting how abortion accessibility is the dominant value that current day abortion activists are promoting. You've all heard the old phrase safe, legal, and rare. That was like the Clinton era pro-choice movement. That was their formulation. Like, we know abortion's not a great thing, but, we should have it be safe. If women are going to do it, it should be safe, it should be legal and available to them, and it should be rare. And the modern day abortion movement doesn't want it to be rare. They do not want it to be rare. They don't want any sort of hindrance to people getting abortions. They don't want limitations on state funding, which if someone thinks abortion should be safe, legal, and rare, they might conclude that the federal government shouldn't fund it or the state governments shouldn't fund it. No, they want the state government to fund it. They want the federal government to fund it. They want public funding for abortion. So instead, what you hear from the modern day pro-abortion left is that abortion should be safe, legal, and accessible, universally accessible. And access is the big buzzword. It's sort of the touchstone for everything they believe about everything. To the point where I believe they are willing to sacrifice safety for the sake of accessibility. And I'm going to talk about this in a couple of ways through Dr. Autry's activism, and this is the activism that she is passing on to the future doctors of California, who are her UCSF medical students and residents whom she's training. So first, with her abortions on a boat scheme. To provide health care, including surgeries, safely on a boat. And I talked with my folks about this. My folks are both physicians. My dad's orthopedic surgeon, 30 years at Valley Children's Hospital. Very successful, accomplished physicians. Generally, if you're offering healthcare on a boat, it's not your first choice. Okay, let's get that out of the way. You'd rather not do healthcare at sea, but you can. And the context in which it is done successfully, and Dr. Autry's sort of trying to back up her desire to do abortions on a boat by saying, oh, there's a long track record of people providing healthcare safely on board boats. Okay, you can provide healthcare safely on a boat when it's an aircraft carrier. Okay, a U.S. Navy aircraft carrier, which has thousands of crew members and a full medical team, a full OR, full emergency resources. That is doable. Like the number of people who serve on an aircraft carrier, like you can have as many as 5,000 sailors staffing an aircraft carrier, okay? So you can have a whole medical team. You could have surgeons, all different kinds of specialties. You could have a blood bank going. That is doable. There are also some certain charities who, like one of these charities is called Mercy Ships. And what Mercy Ships does is they take a team of usually very elite volunteer doctors who want to kind of give back and do something positive for the world. And they will go off the coast of some impoverished, underdeveloped country to provide healthcare services. A lot of times what they're doing is charities like, I think one of them is called Project Smile, where they provide surgeries to correct people with cleft palates who live in underdeveloped parts of the world. And however, the way those charities operate, they're not like on a yacht. They're not on a ship that's like, 30 yards long or 100-foot yacht. Okay, so it's like a 33-foot yard ship. They're on like a decommissioned cruise ship. Okay, so a massive, massive cruise ship, like you're going on a cruise into Alaska or the Caribbean or something. A massive cruise ship where, it's got 4 dining rooms. So we're going to take 3 of those dining rooms and the casino, and we're going to turn them all into operating rooms. Okay, and we're going to have the full complement of emergency services available, blood bank on hand, all the stuff you need for and we've got, usually with those kinds of charities, they get really elite teams of doctors, nurses, et cetera, to volunteer. These are people making a lot of money who have enough money that they feel like, yeah, I'll get on a boat to the third world and give back. So you got, people doing cleft palates. You've got Beverly Hills plastic surgeons who make big-time buku bucks, who are top of their field, doing cleft palate surgeries, for poor kids from Africa or wherever. That doesn't seem to be close to what Dr. Autry's envisioning here. So her charity says, we're at an initial goal of $20 million. $20 million ain't buying you and retrofitting you a cruise ship, okay? It's not even close. And the number of days per year they want this staffed, there's no way they're going to be able to operate the way that Mercy Ships operates or something like that. And furthermore, she's indicating that they're not going to be able to have emergency healthcare services on board. So you're talking about, and the NPR article that discusses, it literally has a quote in it that they are not so concerned about the medical side of this because complications from abortion are so rare. Well, complications from abortion are not zero. Okay, first trimester surgical abortions, I admit, don't have high rates of complications, but when they do, they're bad. Okay, even if it's 1%, okay, if they're going to do, 100 abortions per year, you're going to have one patient who's going to have a bad complication. So, and the kinds of complications you can have from an abortion, okay, ruptured the uterus. You could have a patient bleeding out. And what's their plan? Well, a helicopter ride onto shore to go to an emergency room. Okay, yeah, that's not going to work. Look, as much as I have no great love for the Planned Parenthood clinic on Fulton Street, if something goes wrong there, you can get in an ambulance and be over at Community Hospital downtown in, 15, 20 minutes. You're talking about a helicopter ride from several miles offshore to some hospital somewhere in Texas. Like, how is that going to, how do you expect to get someone there in enough time? So this is clearly an idea that is compromising safety for the sake of access. And we're going to get more into that in the next segment for another thing that Dr. Autry is promoting. Abortion pills being shipped from India to states in America where abortion is illegal. That's next on the John Girardi Show. On Right to Life Radio. We'll be back right after this. Back with Right to Life Radio, we are discussing the interim head of OBGYN at UCSF Fresno. This is someone who's training residents and future doctors in OBGYN here in Fresno. Dr. Meg Autry, a professor at UC San Francisco, who is a radical abortion activist, gave a lecture at UCSF Fresno the Thursday before last, where she was talking about this stuff and sharing about this stuff. And among her various things, or sort of various cockamamie schemes for getting people abortions, include things like abortions on a boat in the Gulf of Mexico, floating abortion clinic where we're going to do abortions up to 16 weeks. Unclear how we're going to provide emergency services for cases that go wrong. And I'm making the point that she is sort of indicative of the broader pro-abortion movement that I think is willing to sacrifice safety for the sake of access, for the sake of making sure people get abortions, even if it's not safe, even if we're going to sacrifice the safety standards just to be sure that people can get abortions. Now, the other sort of example of this that I want to highlight is a further sort of wackadoodle idea, which is the idea of getting abortion pills from foreign suppliers and shipping them without a prescription and necessarily without an in-person doctor visit to patients in states where abortion is illegal. So, this is another thing that Dr. Autry seems to be promoting: aid access. Aid Access is this charity that I think is basically flouting state laws regulating abortion by facilitating women being able to get abortion pills shipped to their homes, even if they live in states where abortion is illegal. Now, this charity, so let me kind of explain all this. So first, just background on the abortion pill. The abortion pill is not the morning after pill. I always have to say this. This is my routine disclaimer. The abortion pill is not the morning after pill. The abortion pill is a drug that alters the lining of the uterus so that the embryo or fetus, who can be up to 10 weeks old, you can take the abortion pill up to 10 weeks into pregnancy per the current on-label FDA guidelines, or later than that if your doctor prescribes it off-label. It alters the lining of the uterine wall so that the fetus or embryo detaches, is cut off from its food supply, fetus or embryo dies. That's what the abortion pill does. So it's not the morning after pill, which it's morning after pill's general role is to try to prevent ovulation, to prevent conception. It does have a backup mechanism to make the lining of the uterus hostile to the newly formed embryo implanting, but its main function is to prevent ovulation. That's what the morning after pill does. The abortion pill is baby, the fetus embryo has already come into existence, has already attached to the uterine wall, could be 10 weeks along. Okay, so that's a different thing. So you take the first drug, which detaches the fetus or embryo from the uterine wall, the unborn child dies, and then you take a second drug called misoprostol, which is a legitimate drug. It's used to help facilitate labor, but you take misoprostol to start labor and expel the unborn child from your body. So that's the abortion pill process. What Aid Access, this nonprofit, this entity that Dr. Autry, the head of OBGYN at UCSF Fresno, is promoting, they are sending abortion pills in the mail illegally to women in states where abortion is illegal. So I think basically the way it's working is it's a bunch of people who are, every party is sort of insulated from prosecution. So Aid Access is just sort of facilitating this, but they're not in these states where abortion is legal. The federal government is certainly not going to go after them under the Biden administration. The suppliers that they're getting the abortion pills from, this was a problem even completely outside of the illegality of the abortion pill. There are illegal websites operating out of India and China where people can get abortion pills without a prescription fairly easily. There was I believe a New York Times story where the male author of the New York Times piece got abortion pills sent to him with almost no vetting and certainly without a prescription. And it was something mailed to him from India. It was either India or China. So Dr. Autry is recommending this. And again, it's another example, I think, of promoting abortion access while sacrificing safety. Because that's the thing. If you're giving someone the abortion pill without an in-person visit, a couple of things you're willing to sacrifice. You're just running the risk that this person might have an ectopic pregnancy and not know. You're running the risk that this person might be far more than 10 weeks along into their pregnancy and not know. And then the complication rates go up as the pregnancy is farther along from the abortion pill. Again, the FDA approval is only through 10 weeks. And again, the sort of narrative throughout all this about the safety and the safety of the abortion pill is a huge thing. When we return, I think I want to dig into this. I want to talk a little bit more about the abortion pill safety, the narrative of how it's talked about, and how it's actually regulated. And it kind of leads into some of the stuff we're doing about letting parents know about issues relating to abortion and their kids. That's next on Right to Life Radio. Returning with Right to Life Radio, and we are discussing this big theme in the pro-abortion movement that I've been noticing. A willingness to sacrifice safety for the sake of access. And I've seen this in what's going on with UCSF Fresno. UCSF Fresno has a new interim director of OBGYN who is a big-time abortion activist, someone who supports having a cruise ship, or maybe not quite a cruise ship, maybe a yacht, I don't know, having a boat in the Gulf of Mexico that's going to perform abortions in federal waters because Texas and Alabama and Mississippi and Louisiana outlawed abortion, who supports shipping abortion pills without prescriptions to women in states where abortion is illegal through shady mechanisms. And I think all of this is indicative that the pro-abortion side is kind of willing to sacrifice safety and healthcare standards for the sake of access, for the sake of people being able to get abortions. So let's talk about the various ways. So one of these ways is with the abortion pill. The left, the pro-abortion left, recognized that the abortion pill was the key to universal abortion access. If you can have a pill that you can take to artificially terminate a pregnancy, and it can be shipped to people, that achieves the goal of universal abortion access. Everyone's got a P.O. box, everyone's got a mailbox, everyone's got a P.O. box, everyone's got an address. If the U.S. Postal Service can deliver it, then you achieve the goal of universal abortion access. So they were so gung-ho to achieve that goal that basically they sacrificed health and safety standards all along the way. When the abortion pill was first approved in 2000, you could only prescribe it during the first 7 weeks of pregnancy. That was the FDA standard. And you had to have in-person visits, I think at least 3 in-person visits with a doctor. They loosened that to 10 weeks. They loosened that restriction from 7 weeks to 10 weeks during the Obama administration. And the idea there was to open up the window when people could access abortion. And they were deliberately loosening the safety restrictions. So the abortion pill had developed this sort of track record of these are sort of the adverse outcomes from the abortion pill. And in 2016, when Obama approved regulations to expand the window from 7 to 10 weeks, his FDA stopped collecting any adverse health data about the abortion pill other than deaths. And we can see from some of these activist websites, they encourage women, like Aid Access, which Dr. Autry from UCSF Fresno is promoting. They right there on the website, they encourage women, if you're having excessive bleeding after the abortion pill, you can go to the ER and tell them you think you're having a miscarriage. So we're not reporting adverse health incidents from the abortion pill other than death. Women are being encouraged when they go to ERs, don't say that you had the abortion pill process. Just say you're having a miscarriage. So when abortion advocates advocate for the abortion pill as safe, we have no idea. We haven't been collecting any adverse health data since 2016, since the time when we loosened all the restrictions, or a lot of the restrictions, on the abortion pill. And we haven't been collecting any adverse health data since 2021 when we further loosened restrictions on the abortion pill. So the current regs under the Biden administration are that you don't need any in-person visit before getting the abortion pill. You can just have a telehealth visit, meaning that you're not getting an ultrasound. You're not going to be able to determine 100% if you're having an ectopic pregnancy beforehand. You're not going to determine afterwards if you've had an incomplete abortion, both of which can be serious threats to your health. I mean, an ectopic pregnancy will kill you if you leave it untreated. And that's where the baby's growing in the fallopian tubes rather than in the uterus. So however, by not insisting on an in-person visit requirement, what is accomplished? Well, it means that no matter where you live, even if you don't have an abortion clinic nearby, you can get an abortion. If you don't have to go to a clinic to get an ultrasound, it means you can still have an abortion. Access is the driving goal. And they keep talking, and this is the insane thing. Dr. Autry said this. Other people from UCSF Fresno have said this, that the abortion pill is as safe as getting your teeth cleaned. Abortion is as safe as taking a Tylenol. It's just not true. There is just no basis for saying that. We only know the tip of the iceberg when it comes to the safety levels for the abortion pill because we haven't collected any safety data since we loosened restrictions on it in 2016. We have no idea. There are problems with how that data is going to be reported or collected. Women we have lots of anecdotal evidence and hard evidence from websites from certain activists that women are being told, don't tell the ER that you had the abortion pill process. Tell them that you're miscarrying. So we have no idea we have no idea of the full picture of the complication rate from the abortion pill. All right? I'd bet there are deaths from the abortion pill that nobody knows about because the ER didn't hear from the patient that she went through the abortion pill process. There were probably patients who said they were miscarrying, and that's all they knew. I mean, I guess it wouldn't shock me. So, I mean, maybe there's factors I don't fully understand with that, but regardless, what we know about the safety of the abortion pill, I think, is likely the tip of the iceberg. And it's so horribly irresponsible, I think, to tell people, it's as safe as getting your teeth cleaned. It's safer than Tylenol. Let's take safety out of it, right? Even if it's as safe as claimed, the abortion pill process is an incredibly drastic healthcare intervention. If we want to call it a healthcare intervention, let me rephrase that. It's a drastic intervention. You are artificially creating a miscarriage. Any woman who has miscarried knows that that's not an easy thing. It's not as easy as getting your teeth cleaned. It's not as easy as a Tylenol. It's a very dramatic, can be traumatic event. That can involve all kinds of much more serious health complications. Excess bleeding, serious amounts of pain. There's risks of infection. There's all kinds of risks associated. Not to mention the emotional and mental health aspect of it, which can be, for many women, devastating. And yet this line, abortion's as safe as Tylenol, abortion's as safe as getting your teeth cleaned. It's not even, you don't even think of it as an abortion pill. It's just a pill to bring your period back. It's Plan C. All of this rhetoric is so unbelievably irresponsible, I think, on the part of these doctors, to act like this is a nothing burger. At least the pro-abortion movement of of the 70s, 80s, 90s, at least some of them had the decency to say abortion is a tragic but necessary thing. No one wants to have an abortion, but we need to help women who need. At least they weren't acting as though abortion is something. Oh, it's empowering. They're like TV shows that clearly are made with Planned Parenthood's influence. I mean, Planned Parenthood has lobbyists basically who lobby Hollywood for positive abortion storylines. This whole article about it, and I think it was in the New York Times, where characters are saying, "Oh, I felt so empowered getting my abortion." Get real. The overwhelming majority of women who have abortions, the majority of women who have abortions don't want to have an abortion. They feel like it's their only choice because of financial pressures, lack of support, whatever it is. And to say to women that it's safer than a Tylenol, as if it's a nothing burger, is so just wildly irresponsible. And that is, I think, the dominant. That is the dominant attitude of the pro-abortion movement. It's this, listen to all women, listen to women's abortion stories, trust women, unless you're a woman who has any regret for abortion. Unless you're a woman who wants to come forward and say, I regret my abortion. I think it was the wrong thing for me to do. Those voices, those abortion stories are ignored, shoved to the side, delegitimized. And this delegitimization of grief, that is maybe one of the most cruel things about what the legal abortion political movement has done. I think there are millions of women in this country who have a grief that no one is willing to affirm, that maybe they're not even willing to affirm for themselves because of some PC BS that's lodged in their head about abortion. I saw this story about extremely lifelike, realistic dolls, like baby dolls, that are being sold in very large quantities on eBay and other sites like that, which it seems like there's this whole sort of mini industry in this. And some sort of right-wing influencer saw this and thought, this seems extremely weird. What is this? What is going on here? And my immediate thought was, there are 900,000 abortions a year in this country. By the age of 45, 1 out of every 4 women will have had an abortion. I think there's an awful lot of people in this country who are hurting really badly. And it's expressing itself in ways like this. Maybe. I think, and it seems very weird. Like, why are adults buying extremely lifelike babies? Well, it's a very weird reaction, but I don't find it incomprehensible. When we return, we will discuss a couple more insane things from, again, the head of OBGYN at UCSF Fresno. That is next on Right to Life Radio. Back with Right to Life Radio, and we'll wrap up our discussion of Dr. Meg Autry, the head of OBGYN at UCSF, and so this is a person who's training medical students, training residents about obstetrics and gynecology, who is herself a big-time abortion activist. We already talked about her desire to do abortions on a boat. We already talked about her desire to ship the abortion pill to states where abortion is illegal from shady suppliers in India. And let's cap it off with some gender identity stuff. So I was looking up more about Dr. Autry, and I'm not exactly sure what exactly I'm going to do other than I'm informing all of you. I might write a piece about it for some local publication. But I'm looking up more about her, and I saw an article, a research paper she did for a major obstetrics and gynecology journal from last year. And it was a case study about a transgender identifying biological female who is identifying as non-binary. So wanting to go by the they, them pronouns. So let's talk about this. This is a 15-year-old biological female who is sexually active with a boy whom the article calls a sperm-producing partner. Okay, because apparently these are the euphemisms we now have to use. Sperm-producing partners. Okay. So, biological girl, sexually active with a boy, also is using pot, has depression, seeing a therapist. Girl is experiencing very painful periods. Okay, not a particularly novel health problem. Lots of women experience very painful periods. And there are lots of ways of addressing very painful periods, from Tylenol to maybe addressing someone has maybe endometriosis or something, to there are various ways in which people use, I prefer sort of a more, there are a lot of pro-life folks who I know and obstetrics and gynecology people I know prefer sort of more natural-based methods of addressing fertility problems like irregular cycles, painful cycles. But there are also ways of addressing it through the use of hormonal contraceptives, including ways of using hormonal contraceptives to sort of stop someone from having periods. So none of this is particularly novel. None of this is necessarily really worthy of an article, a new article in a major journal of obstetrics and gynecology. However, what's actually happening here is that the person that basically what's happening is this girl, her periods are so painful that she's saying it's making me wish I was a boy, that it's making her wish she was not a girl. Her periods are so painful that she's saying that she is gender dysphoric as a result. Which, I don't have a 15-year-old daughter yet, but from my friends who do or have, this does not sound like the kind of thing that is a genuine expression of a gender identity. 15-year-olds can have painful periods and say things like, I wish I was not a girl. This does not necessarily mean it's an expression of gender identity, and yet that is exactly how Dr. Autry and her 3 co-authors are treating it. And what she's promoting here, it kind of relates to abortion and contraception and things like that and stuff that's within us, is basically to prevent this person from having periods for the sake of gender affirmation. And that's what the whole article goes through. Seemingly, this 15-year-old has more sense than the doctors, because she said, I don't want any steroids, and I don't want, I don't want testosterone, I don't want testosterone, rather, and I don't want a surgery. Doctors laid that out on the table, but the 15-year-old seemingly had more sense than the doctors. And so the article is about, here are all the contraceptive methods. So let's stick this 15-year-old on an IUD so that she's not going to have periods. This is the kind of thing this is what is going to be teaching future doctors in California, the residents at UCSF Fresno. This is the ideology that's underlying it. That this kind of IUDs, which, by the way, are basically kind of abortion machines. They don't actually prevent conception. They prevent fertilized embryos from adhering. So this is the ideology at play. That'll do it for Right to Life Radio. We will see you next time on Power Talk.